Hello, my name is Dr. Komloshi. I'm a GP at King's Cross Medical Practice in Ashford. In this series, we talk about common medical conditions that could be treated at home without the need to see the GP. 6 out of 10 people will have low back pain in their lifetime once in the UK. Well, most of us will have it more than once, I can tell. 90 to 95% of these back pains are considered as non-specific or mechanical low back pains, meaning there is no underlying cause that could be found as the reason for the back pain. It comes with muscle spasm, it's hard to walk, it's extremely painful, and sometimes you can't rest with that. You try to avoid every movement because it aggravates the pain. You want to stay still so the pain is not so bad. Sometimes the low back pain comes with sciatica, which is a sharp shooting pain going down to the buttock or down to the legs, sometimes with numbness in different parts of the leg. Okay, you know what it is, you take painkillers, you take it easy for a few days, try to use heat, massage, but if you're still not better after 4 or 5 days, you just can't bear it. You want somebody to do something about this back pain. You just can't carry on like this. If you are experienced in the low back pain industry, you might want to see a private physio or osteopath for some massage and clicking, hoping that it will make it better. But most of us would just go to the GP because they are the first point of contact regarding any illnesses. Your GP will ask a few questions, whether you have any weakness in the leg, whether you feel that you lost sensation in the private area as you wipe yourself after the toilet, whether you feel that you can't control your bladder or bowel, so you can't urinate or you can't hold your number twos. These would be worry signs. But if you don't have any of these, then they will offer you painkillers and suggest you to do some exercises and come back if your symptoms are not better in 3 to 4 weeks. What? 3 to 4 weeks? You can't afford to be like this for 3 to 4 weeks. Okay, then you go to the osteopath. They must be able to do something. Okay, they do massage and clicking. That will give you some relief, normally just temporarily. And they suggest you come back the following week for some more clicking. And in the meanwhile, do some exercises. Only go and see them 3-4 sessions. And after a month, you are actually better. Unfortunately, there is no magic cure for low back pain or sciatica. It does last for a few weeks. Even with the most diligent exercise regime, you will find some improvement maybe after 2 weeks. Simply, this is just how long it takes. And medication don't cure back pain. But what they do, they give you an opportunity to start stretching exercises, because exercises do cure the back pain. It reteaches your muscles to relax at rest instead of spasming up all the time for no good reason. The more you stay still to avoid the pain, the more your muscles will seize up and stiffen. So stay active even if it hurts. Warm up the muscles and do stretches. You might want to do some cardio. You might want to do some swimming to warm up those muscles, because it's much more efficient to stretch warm muscles than cold muscles. Okay, if you have sciatica, you might worry about the possibility of disc herniation. Yes, 90% of sciatica pains are caused by disc herniation, so probably you have one as well. But it doesn't really change the management plan. Take painkillers so you are able to exercise. Do your stretches, and then it will give a chance to the muscles again to relax and for the disc to bounce back to its place and unpinch the nerve. Sciatica, honestly, is more stubborn than mechanical low back pain without sciatica. But most people, 60%, will get better in 3 months' time, and 70% will get better in 12 months' time. I will put the link for an exercise sheet and an exercise video at the bottom of the description box. A wise old man told me that People do everything to get better until they are better, and then they stop exercising. So please, don't stop doing your exercises, your stretches, and your cardio after your sciatica is gone. Carry on with your daily exercises so it reduces the risk for a further painful episode that puts your life on hold for another 3 to 4 weeks. Am I right or not? This is the question. Let's say that you've been doing your exercises, you're taking your painkillers, you do everything what you are supposed to do, but in 3 to 4 weeks, you're still not better, which we saw could happen with sciatica pain. What's next? You go back to your doctor and then you say you would like an MRI scan. Surely something is not right. Something needs to be done for your back. Let's say your GP agrees and sends you for an MRI. You wait some months, if you're lucky, to get an MRI result which will show what? Wear and tear most of the time, maybe impinged nerve, or maybe no nerve impingement. Well, people with sciatica and people without sciatica, like healthy people, can have very similar MRIs. It's not a magic answering machine that suddenly tells you, oh yeah, this is the problem, this is what we need to just fix. The management plan doesn't change with the MRI scan. This is why the national guidelines suggest that GPs actually shouldn't refer the patients to MRI. If there is no improvement with conservative treatment, the patient should be referred to a specialist GP, a specialist physiotherapist, or an orthopedic surgeon. So they will decide whether an MRI would be useful if they suspect that an invasive intervention like injections or surgery would be needed. However, if you don't want any of these, then you might not bother asking for an MRI. You just carry on with your exercises. There would be a few exemptions when your GP is worried and would want to see an urgent MRI to rule out serious underlying conditions. It's very, very rare though. But if you experience weakness in the leg, numbness around the private area as you wipe yourself, unable to control your bladder or bowel, and if you have sciatica on both sides with or without back pain that comes on when you walk, if you have new back pain with a history of breast or prostate cancer, your GP might want to arrange an urgent scan for you. A routine referral or a routine scan could be considered if there's no improvement of the symptoms after 3 to 4 weeks. If your doctor is not concerned and you're not considering an invasive procedure, please don't ask for an MRI scan. It will just give you unhelpful diagnosis like arthritis, disc herniation, or wear and tear in your back. It doesn't help you to get better, it just takes the focus away from your recovery process. Another debate is whether it's ibuprofen or naproxen. Both are anti-inflammatories. You can buy ibuprofen from the chemist without a prescription, but naproxen is prescription only. So it's a no-brainer that naproxen must be stronger if it's prescription only. Well, this is not the case. 440 milligrams of naproxen is equivalent to 400 milligrams of ibuprofen. The maximum dose of naproxen is 1 gram a day, whilst ibuprofen is 2.4 grams. So it means that you can have more than 2.5 times more anti-inflammatory and pain relief effect from ibuprofen than from naproxen. However, ibuprofen is short-acting, so you need to take it 3 to 4 times a day, whilst naproxen is slow-acting and long-lasting, so you only need to take it twice a day. So why is your doctor prescribing you naproxen if you already tried the ibuprofen and naproxen is not stronger at all? Well, the doctor can't just let you go home without a prescription, otherwise you will feel it's a wasted time, a wasted appointment that you waited for so long. So they give you a prescription. Or if you can't tolerate the ibuprofen or naproxen type medication, You can take second-line ones like cocodamol. You can get a weak one from the pharmacist, 8 milligrams of codeine in one tablet. If you need more codeine, it has to be on prescription. You can go up to 15 or 30 milligrams per tablet. Other medication like diazepam, gabapentin, pregabalin, amitriptyline, different antidepressants, acupuncture, corsets, tractions, ultrasound treatment, TENS machine. Well, all these things are considered of very low value according to the national guidelines, so they are not recommended. In summary, medication-wise, first line is ibuprofen or naproxen, mainly for pain relief, so you can do your exercises. If it's not enough or you can't tolerate these or they are contraindicated, you can take codeine or in a form of cocodamol combined with paracetamol. Otherwise, keep calm and do your exercises. I hope you will get better soon.